Welcome to my presentation on psychodynamic theory and psychoanalysis. The three most noted theorists for this theory are, of course, Sigmund Freud, Erik Erikson, and Carl Jung. Now, Sigmund Freud is known as the developer of psychoanalysis. He received his medical degree in 1881 and originally studied neurobiology. He had a private practice treating psychological disorders for many years. He was a pioneer in the understanding of human behavior and developed the most comprehensive theory of personality ever developed. We have a small little video here for Freud.
Sigmund Freud was an Austrian neurologist and the founder of psychoanalysis, and was born in Freiburg in Moravia, but moved to Vienna with his family in 1857. He was an exceptionally gifted child and an excellent student. He attended medical school in Vienna and became involved in neuropsychology research and studied in Paris and Nancy with some of the most prominent psychologists of the time. After spending some time in Berlin, he returned to Vienna and set up a psychiatric practice. He adopted a new form of treatment with his patients that involved talking about their problems to trigger emotional release, known as repression, which is now widely seen as the basis for psychoanalysis. Freud's theories were well received, but he had many disagreements with other psychologists at the time, most notably the psychologist Carl Jung. In 1923, Freud developed a benign mouth tumor associated with his heavy smoking, which he had to have removed. After the outbreak of World War II, Freud went into exile in Hampstead, London, where he continued his work. In 1939, his mouth tumor returned, and he requested the help of his friend Max Schur to assist him in committing suicide. Schur gave Freud large doses of morphine, which ultimately led to Freud's death. Amongst other achievements, Freud contributed to research into cerebral palsy, psychoanalysis, and investigations into the conscious and unconscious minds of his patients. He also investigated dream interpretation and was a strong advocate of repression techniques to revisit repressed memories that have been buried or repressed by the patient, as well as psychosexual therapies. Although a controversial figure, Freud's contributions to psychiatry and psychoanalysis have altered the direction and focus of many psychiatric methods and techniques.
Freud was arguably the most important therapist of his day. Not sure how I feel about that. One of the tenets of Freud's theory was his view of human nature. He believed that an individual's personality is fixed by the age of 6. He also believed that behaviors are determined by irrational forces, our unconscious motivations, and our drives, and that these drives lead to a rise in energy that results in psychological activity. He also felt that most human beings, or all human beings, had a death instinct, and that we all had an unconscious desire to die, but that's kept in check by our life instincts. Another of his important contributions, I'm sorry, my cat's a baby and she won't stop crying, his structure of personality, the id, the ego, and the superego. Now, the id is our biological self, takes care of our primary process thinking, contains our instincts, it's preoccupied with needs and desires, and it's self-centered based on the pleasure principle. The ego, which is the center of our personality, the psychological center, starts to develop around 6 to 8 years of age, and it emerges to help the id satisfy its needs in an acceptable way. Then the superego is our social controller. It regulates our behavior, represents parental values, and the norms in our society. My least favorite of his ideas are the psychosexual stages of development, which are the oral, anal, phallic, latent, and genital stage. Now, according to Freud's theory, failure to have your needs met in any of these stages of development can result in fixation and failure to move past that stage and psychologically immature behavior. Now, the oral phase, if you do not successfully negotiate, could possibly leave us with an inability to trust ourselves and others, and fear of loving and forming close relationships. Now, in the anal phase, it can cause an inability for us to recognize and express our anger, and it can lead to denial of our own power. And then in the phallic phase, it could lead to an inability to fully accept our sexuality and sexual feelings, and difficulty in accepting ourselves as a man or a woman. And I'll just kind of add that I really kind of didn't like Freud, and this was why. So we'll move on to Erikson. He was a Danish, German, and American psychologist who's most known for his theory of social development. He was an ego psychologist. He extended Freud's theory and focused on psychosocial aspects of development after childhood. Now, Erikson felt that Freud didn't give enough attention to the role of the ego in personality development or the social influences throughout the lifespan. Kind of an interesting thing is he was originally an artist. He was hired to paint portraits of children at the Vienna School for Psychoanalytic Treatment of Children. And that's where he met Anna Freud and how he was introduced to the field of psychoanalysis. Now, Erikson had his stages of psychosocial development, and these are psychological and social tasks that need for mastery at intervals from infancy to old age. The psychosexual and psychosocial growth is supposed to take place concurrently in each stage of life. Erikson felt that the crisis is a turning point where you have the potential to move forward or to regress, and that we either resolve our conflicts or fail to master the developmental task, which results in psychological stress and anxiety. Now, at each age, we have our task, like, for an example, an infant up to 18 months old, their task is trust versus mistrust. And if it's successful, they will develop hope. Or from 5 to 13 years, industry versus inferiority. If it's successfully mastered, we would develop competency. And then at 40 to 65 years, generativity versus stagnation. If we were to successfully negotiate this, we would develop care. Now, Carl Jung was a Swiss psychologist considered a pioneer in dream analysis. He studied medicine at the University of Basel and graduated with his degree in psychiatry in 1900. These guys are like really way in the beginning. Jung authored The Psychology of the Unconscious and Psychological Types, and he's credited with developing the introversion, extroversion personality types that are used in the Myers-Briggs, the influence of spirituality, and my personal favorite, the collective unconscious. Now, the tenets of Carl Jung's theory, his 3 levels of consciousness, or the consciousness he felt was always developing, and the ego is at the center. The personal unconsciousness, which contains our experiences, our thoughts, our feelings, perceptions that the ego doesn't recognize. It also holds our personal conflicts, our moral concerns, and our repressed thoughts. The collective unconscious, Jung used collective to indicate it was found within all people. He referred to it as our psychological inheritance, and it holds the whole of human experience. It contains images and concepts that are separate from our conscious thought. I think the best example I've ever gotten of this is like if you give a baby a cell phone, they seem to instinctively know what to do with it. And that is a pretty good example of the collective unconscious. Some more of his key concepts, his tenets of his psychotherapy. He felt that the human psyche is a self-regulating system, that our unconscious has a creative and a compensatory tendency. The therapy relationship is important for healing, and personality growth is continual through the lifespan. Now, Jung coined the idea of the archetype, which is an inherited part of our psyche that produces pattern tendencies of thought. Now, some of his important archetypes were the shadow, which comes from our pre-human animal past. It represents sex and life instincts. The anima and animus are the male and female roles that we are expected to assume in society. The self, which is the most important archetype, represents the unity of personality, and it symbolizes the circle or the mandala. And the persona, which is our public self, the mask that we wear to protect ourselves. There are 4 phases of psychodynamic therapy. The opening phase, that's where the therapist listens, takes notes, and the client engages in free association. And then the development of transference phase, where the client reacts to his forgotten memories from childhood, and the clients evaluate their impulses through the transference process. And then the working through phase, which is slow and gradual. Clients can gain insight into their issues as a result of transference. And the client and therapist kind of work through these memories and increase the consciousness, awareness of their behavior and defenses. And then the resolution of transference, which is where termination begins. And if we do not properly prepare clients for termination, of course, they can relapse. I have a small video, if it loads, that talks a little bit more about psychodynamic therapy. There we go.
Psychodynamic psychotherapy is a depth psychology, and it's a talking therapy which has its roots very firmly in original Freudian psychoanalysis. So in Vienna in the 1890s, Freud developed this idea of personality not actually being born and a given, but something that evolved and could be influenced by your early environment. And from that, he came up with theories of drives and repression, and most importantly, the unconscious. And psychodynamic psychotherapy draws upon those influences in that it thinks about the psyche as being dynamic, as being able to move and shift, but that there's an unconscious component to it. That means that your conscious mind, your brain, isn't always in charge, in control of how you think and how you behave. So in a psychodynamic psychotherapy, the client will be encouraged to talk about their early memories and their early relationships. And they will be working collaboratively with the therapist in what's called the transference relationship. So the therapist will be trying to encourage those early dynamics, those early ways of functioning, early memories, thoughts, dreams, feelings, things that influenced you in childhood, which may have seemed unimportant at the time, but actually are having an impact on the way in which you're living and functioning in the world today.
Now, these are some of the basic definitions and techniques. The blank screen approach. Basically, the therapist avoids any self-disclosure so they can foster a transference relationship and allow the client to make projections onto the therapist. Of course, transference, which is the unconscious shifting of feelings and attitudes onto the therapist. And countertransference, where the therapist reacts to the client and has unconscious attitudes or behaviors that are related to the therapist's need rather than the client's need. The working through process, which is the exploration of the unconscious material and defenses, which can help the client recognize and accept their defensive structures. And it fosters resolution of our old patterns and helps us foster new ways of thinking. Insight, psychoanalysis places insight basically at the center of therapeutic action. It's unearthed through interpretation in the patient's free association, transference, repetitions, dreams, and resistance. Now, free association is known as the fundamental rule. It opens the door to the client's unconscious wishes and fantasies, conflicts, and motivations. The client is encouraged to say whatever comes to mind, and they're free to express anything. They can talk about anything that they want. It helps to unlock memories of the past and can lead to catharsis. The therapist must remain non-judgmental while encouraging the client to let go of defense mechanisms and listen for hidden meanings. Interpretation is where the therapist uncovers and teaches the client the meaning of behavior that's manifested in dreams, in his free association, resistances, defenses, and even in the therapeutic relationship. It enables the ego to assimilate, and it helps speed up unconscious processing. The therapist will assess the client's personality and past and how it contributed to the client's current difficulties. The therapist identifies and translates the client's material and presents possible meaning to the client, and they do this in a collaborative manner to help the client make sense of things and expand their consciousness. Dream analysis, which is considered the pathway to the unconscious, the therapist helps the client uncover hidden meanings by studying symbols in the manifest content of their dreams. Now, the manifest content is the surface content. The latent content is the deeper symbolic content, which is how the underlying impulses in your latent content are translated into acceptable manifest content is called dream work. Now, dreams are a means of self-discovery. It's shared by the analyst and the analyzed, which are most successfully explored in the context of a good, healthy therapeutic relationship. Now, applying psychodynamic theory to group therapy, the psychodynamic model does offer a conceptual framework for understanding history of members of a group and understanding how their past affects them. Transference and countertransference are very important concepts in group counseling and therapy. Group members exhibit feelings towards each other and the therapist, such as attraction, anger, competition, and avoidance, which can resemble experiences they have towards significant people in their past. Now, the interactions between the group members allow them to recreate social situations where they can become controlled versions of their lives. Now, countertransference can be useful also for the therapist to understand the group dynamics and understand his reactions to the group members. Now, also an application for PTSD. This was a study that I found. The psychodynamic model sees reaction to trauma as idiosyncratic. The impact of trauma is explored by understanding meanings assigned to the traumatic events in the client's life, highlighting childhood and developmental aspects. Psychodynamic therapy can be effective in the treatment of PTSD as it allows intervention at the level of human nature. It highlights the understanding of the counseling relationship, how loss and mourning, symbolic functioning, and the impact of early attachments and identifications can all relate to treatment of PTSD. It offers a therapeutic relationship that can provide containment and increase symbolic functioning, allowing the client to put their feelings into words and begin healing. Now, is all of this still relevant today? There is clinical and empirical evidence that indicate psychoanalysis and long-term psychotherapy can lead to substantial improvements in your quality of life. Psychoanalysis and psychodynamic therapy provides clinical frameworks and methodologies of diagnosis that can be used to complement mainstream psychiatric approaches. Now, some strengths and weaknesses. It can be effective with minority clients because clients of all backgrounds have childhood memories, and it does stress the value of intensive psychotherapy and therapist training, meaning that to be a psychodynamic therapist, you have to undergo your own psychotherapy, and it can be effectively coordinated with other therapeutic approaches. Now, some weaknesses, of course, that it's very costly and very time-consuming, and it does require extensive study and supervised practice, and it greatly limits the numbers of providers that are available. Now, some criticisms. It's been criticized as being irrelevant for clients that do not come from a verbal middle-class background. Being as it is essentially a talk therapy, people who aren't articulate and can't really put their thoughts into words may struggle with this type of therapy. And feminist theory criticizes psychodynamic theory that it tends to perpetuate patriarchy and male domination, which could be detrimental to a woman's mental health. Psychodynamic theory and psychoanalysis also do not adequately deal with issues of oppression, racism, sexism, things like that. And that brings us to the end of our presentation. And I appreciate you guys listening to me. Thank you.